Here is a video of my first preloaded patient-ready DMEK surgery on April 12, 2017. I've already made a peripheral iridotomy at the 6 o'clock position using the YAG laser, and I've also stripped away Decimays in an 8.5 millimeter zone. This is the preloaded 8.0 millimeter DMEK graft in the Straco modified Jones tube. Normally when I have this loaded, I've already got it connected to the connector tubing and a syringe, but this time the Jones tube was free and it had a tendency to roll around the table. I would recommend cautioning surgeons not to place this on a flat surface unless there is some kind of border guard to prevent it from rolling off the table. I'm now connecting it to the connector tubing, which is 14 French silicone catheter. This catheter has already been pre-connected to a 5 cc syringe, which has some BSS in it already. During this process, I managed to tip the Jones tube slightly so it allowed some of the Optisol to escape and some air to enter, and a couple of air bubbles were able to migrate up to the bulb of the Jones tube. So it may be best to do this under Optisol or under BSS so that there's less tendency for air to enter the Jones tube. In this case, what I did was depress the plunger of the syringe to evacuate the air at the tip, and this actually was fairly controlled, although in retrospect I probably should have done this in a container filled with some saline or Optisol to prevent the possibility of the graft coming out onto the cloth side table surface. Here I'm inserting the graft into the anterior chamber and then evacuating some of the fluid from the anterior chamber to decompress and prevent extrusion of the graft when I withdraw the Jones tube. I've sutured the wound and I'm using puffs of saline on a 30 gauge cannula through 2 paracentesis incisions to unfurl the graft and get it into the proper configuration with tapping maneuvers. The graft maintained a pretty good blue coloration despite being soaked in trypan approximately 24 hours earlier. I had no issue with visualizing the graft. It kept a nice blue color despite playing with it for about 7 to 9 minutes while I was getting it unfurled and in the right configuration. Considering the fact that it was stained with trypan approximately 24 hours earlier when it was prepared, it kept a really good color and there was no issue with visualization. Here I'm adding 20% SF6 gas, and after inflating the anterior chamber I noticed that the edge of the graft had a small crimp in it where it seemed like it wouldn't unfurl completely. I'll zoom in to show the detail. I did notice that on the post-preparation evaluation there was a note about a touch artifact at one edge. So I presume this was the location of the touch artifact, but this was at the superior border of the graft, and in this case, since it was at the top and the SF6 bubble would be floating up there, I wasn't terribly worried. When I saw him the next day, there was no issue with attachment or peeling back at the edge there. Thank you to everyone at Lions Vision Gift for allowing me to try this new patient-ready DMEK tissue. Thank you to Mark Terry and to Mike Strako for testing this out and developing the techniques which allowed this to become a reality. I want to continue using this in the future. I was certainly very happy with the packaging, the preparation, the shipping, and the nice blue coloration that lasted the entire duration of the case. This shaved time off the surgery and certainly took some of the stress and the time out of the procedure. So I really appreciate the new developments.